Hello, everyone, and welcome back to Dr. Heather ND. Today we'll be talking a little bit about cupping therapy with a focus on important aftercare recommendations. Before we dive in, why is this discussion even important? Cupping is growing in popularity, but explanations on both what cupping is and aftercare instructions are not usually incorporated into a treatment session. Ultimately, by being aware of this information, we want to optimize and extend the benefits of cupping treatments while mitigating risk of possible negative after effects. What is cupping? Cupping is an ancient healing technique that's used to increase circulation to the area of the body over which it's performed, and also to overall improve local tissue health and healing. It involves the use of glass, plastic, or silicone cups, which create suction over the body region or regions being treated. While cupping can be used in the treatment of a number of different conditions and performed in various ways, some generalities and important aftercare instructions will be discussed in this presentation. What does cupping do? No matter whether glass, plastic, or silicone cups are used, they're all doing essentially the same thing, which is creating negative pressure in the tissues. It's almost like the opposite of a massage. With a massage, you're getting positive pressure to the tissues. The cupping is a suction, so it's negative pressure in the tissues. Cupping allows space for old blood, lymph, and cell waste products to drain out and new to be brought into the area. It stimulates local circulation, and cupping also draws out pathogens. And these pathogens are from the TCM, or traditional Chinese medicine standpoint, type pathogens, and we'll see them come up in another couple of slides. When is cupping performed? Cupping can be performed in a wide variety of instances, but two of its main uses are after a lot of excessive or strenuous activity, or in the earliest possible stages of infectious illness, like when you feel you're coming down with something. So why after physical activity? This is to help relieve tension in the muscles and improve circulation in the local area. Muscles get tense and tight after being worked hard, and the blood, fluids, fascia, and other soft tissue can all get bound up alongside the muscles. Cupping helps to move and disperse stagnant blood, fluids, and energy, which spells quicker removal of metabolic waste from the tissue and improves circulation, arrival of nutrients and oxygen via the blood. How about when you're getting sick? Why do we use cupping then? This is to draw out superficial Chinese medicine pathogens before they have a chance to travel deeper into the system. In Chinese medicine, the Wei Qi, which is similar to our Western concept of the immune system, resides in the outermost layers of our physical being, in other words, the skin and the upper muscle layers. Pathogens enter from the outermost layers first, so if you can catch them before they go deeper, you prevent those pathogens from creating full-blown disease. Just some general notes on cupping as we transition into the specific aftercare tips. In general, cupping feels good. It's good for the tissue, similar to massage. It can help keep the skin, muscles, and everything in between healthier when it's done regularly. And did you know that cupping can be done on most regions of the body? It's not for the back only. Why is cupping aftercare so important? Again, as mentioned on the first slide, more and more people are trying out cupping, but many don't know what they should and shouldn't be doing after a cupping treatment. Basically, the cupping creates openings to external influences, which in Chinese medicine are considered causes of or contributors to disease. Try to keep too much heat and especially too much cold, and also damp and wind out while your cupping marks are healing. Aim to avoid these pathogens, again, heat, cold, damp, and wind, for at least 24 to 48 hours after a cupping treatment. Some traditional TCM practitioners will say to avoid those until the cupping marks are gone, but this can be impractical. The most crucial time to avoid these TCM pathogens is in the first few days following cupping. Now for some cupping aftercare do's and don'ts. After cupping, do not go swimming. This includes pools, oceans, bathtubs, etc. And if you can even put off showering for 24 to 48 hours after a cupping session, this is ideal. Do not leave the cupped area uncovered. Do not consume excessively cold food such as ice cream, ice water, raw fish, etc. And I've listed here foods which are cold in temperature, but foods which are considered energetically cold as well are also to be avoided or reduced. After cupping, do not do vigorous activity. And do not get cupping again over the same area until the marks have disappeared. This typically takes from a few days up to a few weeks. After cupping, do take it easy for a day or two. You may have soreness along with the cupping marks, especially if it's one of the first times you've ever been cupped, and this should help remind you to take it slow. Do keep the area covered. Again, the cupping creates openings to those external pathogens, and so by keeping the area covered, we're trying to keep these pathogens out. Do stay well hydrated. Water, bone broth, and herbal teas are ideal for this. Do eat well-cooked, nourishing, and easy-to-digest foods. By doing this, we try to create less energetic demand in the digestive organs so that more healing energy is available to the cupping sites and the body overall. And do schedule your next cupping session once the marks are gone. With regular treatments, you'll get better circulation and less stagnation in the area. Recovery times will continue to decrease until the tissue has reached a new state of healthy. Thanks for watching. We'll see you next time on Dr. Heather, ND.